If a terrorist was in your house, how do you think the military would try and get them out? Would they go in just one doorway and ignore all the other doors and windows and hope to catch the terrorist and eliminate them? Would they drop a huge bomb on your house and destroy your whole house in hopes of killing the terrorist? Or would they post a person with a gun at each door and window and then send someone in to ensure that they catch the terrorist? Well, it sounds like that third answer is the best answer, correct? Well, this is a metaphor for cancer in your body. If you want to deal with cancer in your body, would you do scenario 1, 2, or 3? The third scenario is the best, and we want to talk today how you can accomplish that. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Let's take a look at what the research says about getting the terrorist out of your house. Remember, this is a metaphor for cancer in your body. The house is your body, the terrorist is the cancer. So this comes from a study called Multi-Targeted Agents in Cancer Cell Chemosensitization. What we learned from Curcumin thus far. Yes, they said learned. It's written by Indian authors, so English isn't their first language likely. And this is from 2016. And what we have here is case 1. So if you have a terrorist in your house or cancer in your body, you could try a mono-targeted approach, meaning you send one soldier up to the front door with their gun focused on the front door, and you yell at the terrorists to come out. Well, do you think they're going to come out the front door? No, the terrorists are smart, and tumors are smart. They want to survive. They don't want to die. So they're going to exit through all other doors and windows available. And if you're only one guy with one gun, the tumor is going to get away. So the mono-targeted therapy is akin to, the mono-targeted therapy is you're focusing on one pathway. So in my video yesterday, I discussed how chemotherapy and radiation oftentimes focus on the NF-kappa B pathway, and there's lots of other pathways that the cancer can use to survive or avoid death. And so only putting a gun at one door or one window allows the cancer to survive and the treatment to fail. That's what this diagram is showing us. So that's with normal dose monotherapy. Well, what if we use high dose monotherapy? High dose monotherapy, as you can see, may kill the tumor because now we're not pointing a gun at one entrance or exit. We're now dropping a bomb on the entire house. So this would be equivalent to using a massive dose of chemotherapy or radiation to kill the cancer. But as you can see, at the same time, the house is destroyed. So you may kill the cancer with the chemo radiation, but you're also going to kill the healthy cells of the host, being yourself. So you go through the chemo, yay, the cancer's dead, but now I'm unhealthy, and all the cells that were healthy before, maybe I'm expressing symptoms, and maybe a couple of years down the road, I now manifest a new cancer in a separate tissue that may have been injured initially by the chemo. So this is not a favorable strategy because everyone dies this way. So the last case is multi-targeted therapies, and this is where the plant-based strategies come in to augment the chemotherapy and or radiation. And this is where the curcumin, the resveratrol, the berberines, the various things that the studies show are augmenters or promote chemosensitization. They improve the chemotherapeutic treatment effect. So they improve the tumor killing by the chemo, and they improve the survival of the host. So the metaphor here is now we have a soldier with a gun pointed at every entrance or exit. So where's the terrorist going to go? How's it going to get out? It's not going to get out without being killed and subdued. And that's what the multi-targeted therapies do. You have the chemo, which is a mono-target therapy, but then you have the plant-based substances like a curcumin or resveratrol and berberine, those things, and they're now the other soldiers watching the other windows and doors, and not just focusing on NF-kappa B, but focusing on other pathways as well. So that terrorist or that tumor has no escape route, has no way to ensure its own survival. It's the highest probability that we're going to capture that terrorist and subdue them or kill them, capture that tumor, that cancer, subdue it and kill it. So again, this study did a great job of visually showing us what's the best anti-terrorism strategy or the best anti-cancer strategy, and that's going to be the mono-target therapy of the chemo and or radiation in combination with the multi-target therapy of the curcumin, resveratrol, berberine, or other multi-target natural plant-based substances or herbal substances that have been thoroughly researched and discovered. So if you are dealing with cancer in your life or in the life of a loved one, I would recommend sharing this information with your oncologist and with your care team and see if they see about adding multi-target therapy to your mono-target therapy.